Dr. Rosalind Austin, host of Researcher Revealed. Come along with me to the Heart Failure Association World Congress, a scientific meeting supported by the European Society of Cardiology. This year, it was in Belgrade, and I wanted to particularly focus on nurse researchers and to discover a little bit more about the research that they were presenting at the meeting, as well as get some top tips for nurses who might want to attend a Congress in the future. Remember, if you're listening to the audio version only, that the best place to have your questions answered is over in the YouTube comment section of this video. And also, as a special bonus for this episode only, I've also included a few clips from my travels and adventures outside of the Congress there in Belgrade. First up, I sat down with Martha Kyriakou from the European University of Cyprus. She tells us all about her research. I'm Dr. Rosalind Austin, and today I've met up with the very lovely Martha from Cyprus. I just actually had the honor of watching her present her research, so I've asked her to come and share a little bit with us on Researcher Revealed. Martha, can you tell everybody who you are, where you're from, and what you do?
Thank you, Rosalind. I'm from Cyprus, as you said before. I finished my PhD in 2020, and I left the clinical setting and went to academia for 2 years.
Okay.
So now I'm trying to set up in the academic field.
Ooh, okay.
Okay.
So nurse by background, master's, PhD, check. And you've just presented, wow, such impressive research. So everybody who wasn't there, so it was a pragmatic RCT that was looking at a very comprehensive intervention to support patients with heart failure. Can you just share with us, I know you just did it in 3 minutes, but in 1 minute, can you share with us a little bit about your study and the major finding from it?
Yes, this was a randomized control trial, as we said before. We used a complex methodology to design the intervention of the study, and till the pilot results, it was my PhD. And then we continue this interventional program, and now we presented the preliminary results of the support heart program. This program is a multi-disciplinary program for heart failure patients with multi-interventions. So we educated the patients about the symptoms of heart failure, the pharmacological and not pharmacological treatment of the disease. We had a telephone support line for the patients, meetings every month with the patients to discuss with them, remind them a few things, and empower them, of course, to continue do self-management. And consultation about things that they would like to discuss with us. This program had multiple outcomes that we measured. Today we presented the health-related quality of life and the anxiety and depression, but we also measured the social support that they received.
Interesting.
And other things like the adherence to the physical activity or the difficulty that they have to maintain physical activity. So till now we had the results about the health-related quality of life and anxiety that was positive. And we continue this research in a volunteer base in Cyprus because we don't have structural interventions within our healthcare systems. So that's the main goal now. I would like to incorporate those services
into healthcare services.
The healthcare system.
Ooh, so now you've got to switch into policy advocacy work. Whew, oh, so exciting. Yes. It was incredible just to hear about your research. Just really quickly, you said that it was a multidisciplinary intervention. So which professionals were involved in providing that intervention?
That's a nice question. We had, of course, cardiologists.
Okay.
We referred the patients to the cardiologist. if they have some symptoms or that their vital signs were abnormal for those patients, especially because we knew the baseline vital signs for them, or if they had some new symptoms, of course, and we wanted to go in the clinic and check for them. We had a physiotherapist that was involved in the physical part and the exercise.
Yeah.
And then some other collaborators that it was not in the research team, but we could refer the patients.
Okay.
Yes,
Oh,
if they
nice.
would like to have a consultation about their dietologist.
Oh, wow. Oh, that's really cool. So a really comprehensive package then for these patients to be able to learn about their illness, better manage their illness, but also I think importantly, one of the things that struck me about your presentation was you said that you gave those patients a contact number to a clinician that they could get in touch with. And I think it sounds like such a tiny thing, but I think it's actually a really big thing, because like loads of other studies have reported how patients are saying over and over and over again, we can't get access, we want help, but we can't get access. So I think like amazing work. Congratulations on the poster, and fingers crossed for the advocacy to get smoothly through so that it can be part of normal healthcare services. 2 more quick questions. I could talk to you forever. Question number 1 is, do you plan to publish this work?
Yes, we started
good.
writing now the results, so hopefully next year.
Fingers crossed. Publication.
Yes. It's taking forever.
Well, because you have the writing, the revising, the getting all the co-authors, the submitting it, and then the peer review, and then just goes on and on and on. Cool. Last question. You talked about for you how, you're a nurse, you've done a master's, you've done a PhD. Is that normal in Cyprus, or are you just special?
In Cyprus, we do have a lot of nurses that they are doing a master degree, not a PhD, of course, but the majority of the nurses, they are willing to do a master degree and get a specialization in some area.
Oh, perfect. Thank you so much. We'll end it now because they're starting to present behind us, and I don't want to
Thank you for the conversation. It was very nice.
Yeah, likewise. Thank you, and enjoy the rest of the Congress.
You too.
Okay, bye. Next, I spoke with Cathy Farrell from Letterkenny University Hospital in Ireland. Hi Cathy, thank you so much for agreeing to have a quick chat with me, to give me the inside loop on what it's like to be here at the conference and to present. I went to your presentation yesterday, but before we get into that, I'm getting too excited, moving ahead of myself. Can you just introduce yourself to everybody, tell us who you are, where you're from, and what you do?
Sure, thanks for inviting me. I'm Cathy Farrell. I'm an advanced nurse practitioner in Ireland, Donegal. It's a rural county up at the top of the country. I've been a heart failure nurse for 19 years, I realised yesterday, so I'm quite a long time at it. And I was delighted to present on, we have a relatively new service over the last 4 years, and I looked specifically at the referral rates of women and whether they were being diagnosed with heart failure.
Yes, that's like, so when I was going through the program, maybe because I'm a woman, I don't know, maybe because they're really underrepresented and I'm like such an underdog, and I found I support underdogs. I'm not an underdog, I support underdogs, and I was really fascinated to hear in your presentation yesterday that you discovered that actually, where you're at anyway, there's equal representation in clinics. So to me, I wrote this down when I was reflecting about things yesterday. Where are the women when it comes to research then? How come we can't get them in?
It's so difficult, and it's not even, I don't even know if it's about getting them in. We know so far from all the clinical trials, women are underrepresented in every clinical trial.
Yep.
So we've got evidence for heart failure that we don't know if it works in women.
Yes.
We know that they're less likely to be under a cardiologist specialist care when they're in hospital. They're less likely to be referred for cardioversions, for pacemaker devices.
Yep.
So these women are in our clinics.
Yep.
What I was worried about is, are women not being referred? Because it's the general practitioners that are seeing these people, and heart failure, as you know, has so many symptoms, many of them vague. Using pro-BNP can be something or nothing at certain levels. So I want to see, well, are they actually sending the women in? And I was delighted to see they were. So in now it's 1,000 patients in a small one county in Ireland, but of 1,000 patients, 49% of them are getting referred in.
But I think, like, for me, hearing that yesterday, like, yes, it sparked curiosity as to where they then disappear to. For me, it was so reassuring to hear that at least they're starting that journey. So it was really, really fascinating and a really interesting piece of work. So what next, Cathy?
Well, I want to look at it a little bit more, particularly in women, and there is a real focus on women, because you're right, up to now they've been a little bit lost and a little bit left behind.
Yeah.
But they're centre stage now. Everybody's going, why are we not treating women the same? Is the evidence there?
Yeah.
Are the treatments that we're seeing works for heart failure? And we're finding they don't. The drug bioavailability is different. You know, their blood pressure tolerance of drug doses is different. So we do have to focus more, and I think that's what I would like to do next, is have a look at actually our treatment of women with heart failure and see what the outcomes there are.
Oh, that sounds fabulous. I was chatting ages ago now to a colleague, another nurse researcher interested in heart failure and cardiac things. And she had like the most poignant thing to say, because she similarly looked at all the research and was like, well, where are they? Where are the women? And these are her words, not mine. And she said something to the effect of, do we not get sick? Mm-hmm. Do we have some sort of superpower? Or are we just absent? And she believes it's the latter, is we're not, well, we being women, women aren't there in that research base. And so we don't know how to treat them. We don't even know really how well they present. I had a patient who told me the most heart-wrenching story as a female, listening to her, where she fought and fought with the GP to get attention. And these again, her words, her GP kept looking at her and being like, you're a postmenopausal woman, you got too much weight on, yada yada, and didn't ever consider her heart. And it finally got to a stage where she was critical and ended up in emergency. And you know the reason why she was ignored? Is she didn't put the weight on in her legs, she put it on her chest and her belly. And nobody looks for it there because it's not listed as a presenting symptom. And then she went on the right treatment and she lost so much weight and she was back to who she was. Yeah. But you know, we don't know.
I hear stories like that all the time, but I actually think it's a little bit, I think the women underrepresentation is the same way as the older people underrepresented.
Ooh,
I think it's the younger being male patients, and because women don't present with heart disease till later, we have that protective estrogen effect.
Yeah.
So then they're part of that older population that are left behind, and it's just disproportionately women, that population. I think so.
Fascinating. I cannot wait to see where you take your research, how you move things forward, and I already follow you on all the socials, so I'll be getting the updates very, very quickly, because I could sit and talk to you about research forever. But sure, sort of shifting gears a little bit. Was this the first time you've been to this Congress?
No.
Was it your first time presenting?
No.
Oh, okay, so you're pro.
No,
perfect.
I'm not. It was my first moderator poster, and I was very excited to have that. I was lucky enough to present at the ACNAB Congress 2 years ago on similar service, but it was about nurse practitioner diagnosis of heart failure. So it was similar. And I've had a couple of just general poster presentations, but I'm always excited to come. As I said, I've been a heart failure nurse for 19 years. And
let's gloss over that bit.
Was lucky enough to come to a couple of congresses early in my career. Yep. So in maybe 2005, 2006, 2007, those years. And I was one heart failure nurse in a small hospital in a rural county. Yep. We had a cardiologist, but not particularly heart failure focused. There was no doctor-led clinic for heart failure. It was just a nurse-led. And I needed the evidence. I needed support, and this is where I found it. I found my fellow heart failure nurses. I found my even Irish heart failure nurses. It was at these ESC conferences.
Really?
And we created then a national group by meeting at these meetings. So it's been so important for me as a lone heart failure nurse to feel what I'm doing is right, that I'm up to date, you know.
Oh,
so it's fantastic.
Thank you so much for sharing that. That's an incredible story, because I think there are loads of nurses who are out there who are like, you know, either lone or they don't have like, they'll look on social media, they'll hear things like this and they'll be like, oh, it's not for me because I'm all by myself and I don't have a gang around me and all this other stuff. So it's so inspiring to hear that you found your gang here.
And we suffer from imposter syndrome, don't we, as nurses? So we look at all these people on social media. I'm a great Instagram versus reality one. I present myself as a very dynamic nurse. I'm pretty dynamic, but I'm a nurse. I see patients. That's what I do, and I don't have a lot of time. Research is a big part of my role on paper, but actually, in day to day, I'm nursing. I'm looking after patients, and then I'm trying to fit in time. Because if we don't fit in time to actually look at our service, audit what we're doing, look at implementing new strategies, then we don't know that we're effective. And it was coming to these congresses that made me realise that actually if I wanted to expand the service, because I now work with a team that I didn't have until about 3 years ago, that team only came by me looking at our service and presenting our gaps in service and comparing it nationally and internationally of what we were doing. So I learned all that at these conferences. I learned how to work smarter, you know.
So, question, do you have, other than like the learning that you've done through networking for the people that you've learned, have you done a master's, have you done a PhD, have you done any formal training around how to do research?
Well, I've done a master's degree, yes. So, and I did, my research for that was a systematic review and the role of advanced nurse practitioners in heart failure. I didn't publish it, and it's forever my regret.
Need to do it.
It's too late. Somebody else has done. It was 10 years ago.
No, it's never too late.
I'd have to update it, and
that's fine.
My tutor kept saying, you need to publish this. There is nothing out there for nurse practitioners. You need to get it in the data. And last year she kind of went, or the year before, she went, okay, somebody else has now published it. She was fed up of me dragging my feet. So that's one big regret, that when I'd done all that work, I didn't progress. And I don't count myself a researcher nurse, even though I do a lot of service improvement and I do try and research. But I think as nurses, we think that we have to be really academic, full RCTs, you know, and I don't. I'm not that researcher. I'm an action researcher that I then evaluate what I'm doing.
But that's an important puzzle piece to our knowledge base. And if all you do as a researcher is stay in the library, stay in the lab, then how do you make sure that you have impact where it needs to be? So I would actually argue, one, you are a nurse researcher, and two, you're a very important type of nurse researcher.
Well, thank you for that. But sometimes we still suffer from imposter syndrome. I enjoy service improvement. I enjoy looking for gaps. I look at every time I come to a congress, it remotivates you. Go like, I've learned something. Oh, they're doing something else. I could look at, could we implement that and would it work? So there is new services. For example, at the moment, we just got funding for point-of-care U&E testing. So we live in a rural place where we take our clinics 50 kilometres from the hospital out to the patients' areas, home areas. But our problem was getting those bloods back to the lab. So we now get point-of-care testing, and we will evaluate that, and we'll have a poster next year, hopefully.
I was going to say, watch this space. If you don't already, make sure you follow Cathy on social media, because I'm sure there's exciting things to come. Last thing, very, very quickly, before we run, because otherwise we will miss the big Nurse Investigator Award session. Top tips. Okay, think about a nurse. She's never been to a congress. She's all by herself. How does she get to be sitting here having a chat with you?
Yeah, so it is trying to reach out locally, because it's easier to come to something like this with a friend. But if not, just be brave. Feel the fear and do it anyway.
Feel the fear. Oh, I love that.
Because the first time I came, I was like, nobody's going to talk to me. What if I just stand out like a sore thumb? We're not. We're all friends, and every year we have new heart failure nurses joining our group. We're very lucky. The Irish contingent, there must be 16,
you're like the
17.
mafia.
We are like the mafia. but we're a really cohesive national group, and we kind of work well together, trying to get support to travel together, and it does make a difference. Not everybody's lucky enough, but there is usually nurse education funding that you can get. The fees paid. It's a reduced fee for nurses. If you get an early bird, but it's trying to just make yourself get there, because it's well worth it, and you know yourself. It's just such an enjoyable few days. I love it. Yeah.
I love it. Thank you so much. We're going to call it, because otherwise we'll be here for the next 3 hours chatting.
Thank you for having me.
I will head off to the next session with you.
Me too. See you later.
Okay, bye.
The next nurse researcher I sat down with was all the way from Israel, Tamar Meizner. Right, I'm here with Tamara. I just listened to your amazing presentation on remote telemonitoring led by a nurse in Israel. Can you just introduce yourself to everybody out there?
Yes, hello. My name is Tamar Meizner. I'm from Ichilov Hospital in Tel Aviv. I'm actually the head nurse of the cardiac clinics and also a heart failure specialist nurse. And that's how I got to do my research about heart failure.
That's perfect. Now, I know you just did your presentation and you had to do it under 3 minutes.
Yes.
Now I'm going to raise the bar and say, in a minute, can you tell everybody very briefly about your research that you've just presented?
Okay. So actually we spotted an issue that we want to take care of heart failure patients and get them to the optimal GDMT treatment. But a bunch of problems such as getting to the doctor and their adherence to the treatment will take them more time to get there to the optimal GDMT. So what we did is we got a remote monitoring model that actually we download an app. I'm in touch with the patient on a weekly basis, and that's how we can we actually do an up-titration of the medication according to the measurements they put on the app, and we got great results.
That's amazing. Now I just have a couple of questions. One, are you the only nurse who's doing this?
So I'm actually the first nurse who did it. And thank you. And there's another nurse, her name is Ella, also working with us, and our goal is to have many more nurses. They have to go through a special course, heart failure course, to be specializing in. Yeah. And we really want it to be as big as possible.
That sounds amazing. So you do this full time, and in your initial research, just remind me, I can't remember the numbers off the top of my head, how many patients were enrolled in your remote patient monitoring?
So it's just an initial one. It was 15 patients.
15 or 50?
15.
Okay.
But since then, we got many more patients.
Okay.
And it's only 15 since we got the app installed. Before that, we started doing remote monitoring without the app with different stuff. And just when we got the app installed, we saw a big progress in our treatment, actually.
Very cool. Now, practical question. You're a nurse. You've done this specialized training around heart failure.
Yes.
Where did you learn your research skills to be as confident to submit an abstract, to fly all the way from Israel to here in Belgrade in order to present here today?
Well, I have to say I have an amazing professor, Dr. Michal Laufer. She really motivates us to go and do research. I never thought I would do something like this.
Well done, you.
Thank you. It really opened my mind to do maybe more research in it, and I really encourage everybody, if they have a good support or even if they don't, just to go do it, because it's different. It opens you a new mindset. Yeah. And that's what's really special. And that's what's so special about us being nurses is you're not limited to just doing one thing. I started as an ICU nurse, cardiac ICU nurse, and now I'm the head of the cardiac clinics, and I never thought I would go to an international conference, and I'm here, so you never know.
I'm so excited for you. It's been such an honor to meet you.
Thank you.
One last question before we wrap up is, what would your top tip, now whether it's people who inspire you or through to practical issues, what can nurses do to make it so that it's possible for them to be in your shoes in a year's time?
Wow, thank you. I would say, well, first of all, if you have that support where you work, that is very helpful. I would say think out of the box.
Ooh, I like that.
I would say that. Don't determine whether you're capable or not. I never thought I would stand in front of people and talk. And I'm happy to be, I don't know, I won't say the only nurse here, but I don't think there are many nurses here.
Not many.
And I really encourage everybody who wants to do something more to just go for it.
Oh, that's amazing, Tamara. Thank you so
Thank you.
much for being willing to be spontaneous and have this conversation with me.
Thank you.
It's been a real honor to meet you.
Thank you, me too. Thank you very much.
Next, I spoke to an advanced nurse practitioner in heart failure, Norma Caples from Ireland. Norma, what a wonderful presentation. Thank you so much for agreeing to have a really quick interview with me. For everybody out there who's listening, can you introduce yourself and let them know who you are and what you do?
Thanks a million. My name is Norma Caples. I'm a heart failure nurse from Waterford in Ireland.
Oh, very nice. So, heart failure nurse from Waterford, Ireland. Why are you in Belgrade, Serbia?
Oh, because I've had the greatest of honour of being able to present some of the results of my PhD study. So I'm a scholarship-funded PhD student in Trinity College Dublin at the moment, and I'm on year 5 of my part-time PhD study.
Congratulations,
Thank
that's
you.
amazing. So scholarship, PhD, now a presentation at an international conference. Is this the first time that you've ever presented research at a conference?
No, it's not the first time. I've always been interested in not research as per se, but I've been interested in seeing how can we change things to help patients. So as part of that then I'd be measuring the impact of it, which is turns into research.
Turns out to be research.
But it's that patient-centered impact that I'm always interested in.
Okay, perfect. So, very, very quickly, now I know you just did it in 3 minutes, but I'm going to raise the bar. 1 minute. Tell us about the research you just presented here.
So my research is that I wanted to see would a simple app help people better to monitor their daily weight in heart failure as opposed to using the daily logbook.
Okay.
And then I did, they used the logbook for 12 months, then they used the app for 12 months, and then I compared the two. And it showed that yes, they were able to monitor their weight more frequently using the app. They were able to identify when weight was increased, and they were able to make contact in earlier with their doctor or their nurse, and this actually reduced hospitalisation rates, it reduced length of stay for the patients as well.
Wow, that's phenomenal. All in your PhD. So, how much longer till you finish your PhD, and what's next for Norma Caples?
Another 12 months, I hope, I'll have my PhD finished, and then and next then after that will be probably what my friends would be saying, probably on to the next project.
Nice.
Yeah.
Very cool. Right, last question. Nurses out there, like you said, turns out a lot of what we as nurses do is research, don't tell them. But what was it in general that led you towards a research pathway?
Well, I do believe that nurses are one of the greatest innovators in healthcare. Our skills at problem solving are phenomenal, and that we're there at the front line seeing the problems and always working out on a daily basis how can we make this easier for the patient.
Yeah.
So for me then, that what I wanted to see then was with my research, would I be able to help the person? It turned out that I wanted to see, could I improve their ability to notice that weight gain was increased?
Okay.
And from that then, I wanted to see, was my actions of value? And that then turned out to be research.
Ah, very cool. Excellent. Thank you so much for your time, and enjoy the rest of the conference.
Oh, thanks a million. Bye now.
Bye. Finally, I spoke to Professor Lis Neubeck, who was actually an invited session speaker at this conference. Hello, Liz. Thank you so much for giving me a couple minutes of your time at this very busy conference we've been attending for the last couple of days. Can you just introduce yourself to everybody, who you are, what you do, where you're from?
Hi everyone, my name is Lis Neubeck. I'm a Professor of Cardiovascular Nursing and I'm the Head of the Cardiovascular Health Research Centre at Edinburgh University in Scotland.
Ooh,
So exciting. You probably know Barbara Ferguson then.
I do, yes.
Yeah. Oh, I love Barbara. Anyway, getting sidetracked already. So if you could just share with me a little bit, I know what you do, but share with everybody else out there, what sort of research are you doing as a nurse?
Yeah, so I'm really interested in the use of technology, digital tools to enhance patient self-management. And I've been doing that for quite a long time now. I really started off looking at how people who don't access cardiac rehabilitation could potentially look for alternative support through originally telephone calls, then website, and as it's evolved into digital apps, into other types of technology that help people with their self-care. And so I came from a background as a cardiac rehab nurse, and I moved into research, about 17, 18 years ago now.
Wow.
And did a PhD looking at how to support people following acute coronary syndrome. But then I became really aware of the way that risk factors affect lots of people. So I've done a lot of work into atrial fibrillation and supporting people with AF and self-management.
Okay.
And latterly, because I met some patients who really showed me that they didn't have enough understanding about how to look after themselves, I've been doing research into spontaneous coronary artery dissection, or SCAD. So a very large part of my work now is in SCAD.
Oh, that's cool. So diverse, but that central hub being digital technology, stuff like that. Okay. So for you at the minute, what's the big project you're either working on or developing to get funding?
So we're working on a couple of big projects around what patients who've had spontaneous coronary artery dissection need to help support them to recover. One with a focus more on the psychological side of things, and the other with a focus on trying to understand exercise in SCAD. Because there's lots of questions about SCAD, and we tend to be very conservative in our prescription of exercise advice. And what we're testing is to see if people can manage to follow the ESC guidelines for secondary prevention of cardiovascular disease. And looking to see perhaps if there's we could push people with SCAD a bit further.
Okay, very cool. So I attended the telemonitoring session yesterday, of which you were one of the esteemed panel members, and you said something in your talk that has just been like jiggling in the back of my head, and I was wondering if you could discuss a little bit more. In the talk you were mentioning, like, yes, it's powerful, it's important, it can support patients, all of these things, but you talked about things along the lines of like how much work it creates for the nurse, the bulk of the data, the implications of what do we do with the data, green stuff like that. And I'd never heard anybody in a congress, at a conference, talk about those other sorts of lesser focused on areas of digital health, because I think so many people are like, yay, it's the miracle cure.
Yes, and I think, for me the most important thing is recognizing that nothing is a miracle cure, and it's always going to be replaced. In fact, whatever we put into practice now is already out of date. So we have to build systems around patients to support them. But the more data we generate, we have problems with where to store it. We have problems with GDPR, so we need to make sure that we're storing it in a way that is safe and secure. We need to know who owns the data, what happens to the data. We also need to be mindful of the workload we're creating if we don't create systems where we're able to filter the data in a meaningful way. And when we start to say, well, we'll use AI to sort this, that's all very well, and I've great thoughts of the future of AI in this space. But AI uses a significant amount of energy, and much more so than a standard Google search, for example. So every time we're relying on AI, we're creating a potential problem for the climate, for the planet.
So I was so appreciative of you saying that, because I think it's a really important, all of those factors are really important things to think about when it comes to digital health, and about how we as researchers, whether we're nurses or medics or computer science people, need to figure out how to better evaluate these apps, rather than just the old standby of are you alive or dead, are you in hospital or not. So what sort of ideas, hopes, plans do you have around trying to better unlock those lesser highlighted areas?
Yeah, so I think think what we're talking about here is the complexity of what it actually is inbuilt.
That's a better way of saying it.
Into digital apps. So all digital apps have multiple components, and even the very simplistic digital apps are enabled by people's interpretation of what they're being told. So I told the story of the wonderful Laura, who is a research assistant recruiting patients to a text messaging study, and the patients genuinely believed that they were talking to Laura despite having been told that this was a one-way text message. So we have to understand the psychology of human behaviour here, and I think that's what we don't always get when we just look at binary outcomes of dead or alive. We need to understand patient-reported outcome measures, because that's often what's more important to the patient. So quality of life, ability to undertake their daily activities of daily living, how does it make them feel? Those things are really important. But also I think it's important that we plan to implement these things. So upscaling any digital intervention, you can't assume it's going to work the same in every centre that we deliver it in. And if we haven't recorded these different metrics, we don't know. So it might be that in one centre, the person who was recruiting people to take part in a digital study was really friendly, and in another centre, the person was just there for a few weeks, they didn't really understand the purpose. And what influence does that have on the impact of that study being implemented? And of course, more broadly, when it goes into clinical practice, how do we enable people to do this? And how do we give the practitioners the skills to work within a digital environment?
Oh my word, you're like adding so many questions to my list, it's ridiculous. I could chat to you forever about this, and I might after off camera, but just conscious of the time. You've been doing research now, you said, for 17 years since you finished your PhD, so I'm guessing this is not your first Congress. What brought you specifically to this Congress this year?
So it's a really exciting opportunity to network with people in the field, and I was invited, luckily enough, to talk about telehealth in relation to heart failure. And for me, that's really wonderful to come and experience a new environment and meet with colleagues from around the world, have opportunities for discussions like this, where we live in the same country effectively, and we don't meet. So we've come here and we've met for the first time, and it's been a fantastic opportunity to get to know each other and to understand where everybody's coming from. But going to a Congress is a really big deal, and I think you have to remember what a privilege it is to be allowed to come here. But also, I feel it's lovely to see the new generation coming along, and I hope that they feel inspired to start going. My big entry into the ESC community was actually through ACNAP, the Association for Cardiovascular Nurses and Allied Professionals. And I've made the most wonderful colleagues and friends from around the world through that community, and had opportunities to join other groups such as HFA. So I think for me, I think that's a really nice, friendly, smaller conference to start at, to get to know people, and then perhaps come to larger conferences, which can be a bit more intimidating. There are 5,000 people here, so that sometimes can feel a little bit strange, whereas if you start small and work your way up to a very big community, and you'll meet friends along the way.
That's such a great tip for people out there who might be like following along virtually, being like, I want to go, like to start small, maybe even just start with a local conference or something like that. Do you have any other top tips for nurses as to ending up sitting potentially in a year's time next to you at a conference somewhere?
Yeah, so I think the most important thing is actually audit your work and submit it. So we need to know if what you're doing is working, both in clinical practice and in research. So if you've done something, tell us about it. We don't want good advances to just sit in a single department. We want them to be spread, and this is a great way to disseminate what you're doing. So please, I encourage you to put information, put posters, put abstracts in, come along, and when you do come to the conference, come and find me, and I'd be very happy to talk to you about my own journey and how I've become somebody who potentially gets invited to these wonderful conferences, and maybe then we could help people to develop and grow.
Oh, it sounds amazing. Just full disclosure for everybody out there, this is, well, we did chat a little bit yesterday, but I have been a long time admirer. I see you on social media, I've read your papers, and like as much as I've had loads of conversations about lots of people, you were somebody who was like, a bit nervous to approach, and I can attest she's lovely in person, and it's been so great to get to know you, and we've had
conversations offline as well as this publicly. So thank you so much for your time, and thank you so much for supporting people like me.
It's a great pleasure. Thank you for inviting me.
Thank you. Bye.
What an inspiring bunch of nurse researchers, from very experienced to first timers. Take Norma's advice, embrace the fear, and hopefully I'll see you at next year's conference. Bye.